Hello everyone, my name is Dr. Adnan and here is the USMLE guide which I made for you guys, and it will help you to understand what is USMLE exam and how to get high score like 250s in USMLE exam. So first of all, I start from the study material. Here is the study material, Kaplan videos and books. Focus on your study materials such as Kaplan books. Don't waste your time in big books like Guyton, Physiology, Gray's Anatomy, or especially Step 1. Study Kaplan series, read it again and again. Memorize the concepts, don't mug it up. Watch videos again and again if you do not understand it at the very first time. For step 1, focus mostly on pathology, pharmacology, microbiology, biochemistry. Does not mean you just leave other 3 subjects: anatomy, physiology and behavioral science. For behavioral science, do a lot of questions. I really feel this subject is really difficult for a medical student to understand, like biostatics. So do a lot of questions to understand biostatics. This is the only one which is going to give you hard time in real exam, believe me. So road to high score. Here I make photo for you to understand how students goes from step by step in the preparation of USMLE. So for the Kaplan books and videos, it depends, but give it a proper time. Do give it a proper time, and when you completed Kaplan books and videos, go to QBanks and do a lot of questions for every single topic. And if you're done with the QBank, go to USMLE World, do it many times. UWorld will really help you to understand very difficult questions. So if you do the difficult one, you're gonna be very well prepared for the real exam. So after UWorld, do first aid. This is the first aid for USMLE or the step 1 CK. Actually, you can download first aid from my blog, and if you comment me, I'll send you the link where you can download first aid books for step 1, step 2. Now after first aid, you go to NBMEs offline. Do offline first and do online. When you will do online, you will understand where you are in, like how much you're gonna get in the real exam. So here I have written something like, if you get high score in your NBMEs online above 250, sit in real exam. I bet you you will get the same result in real exam, but please make sure do not do it in hurry. It is really important because some students give the exam without knowing their scores in NBMEs, and what they do, they just pass the exam with low score. Important things is, please make sure that you are prepared enough, you are well prepared. So your goal is to achieve persistency and regularity. Make your study routine, memorize concepts again and again, study in groups, make sure you are having flashcards which will help you to memorize the concepts when you do it next time. Take proper sleep, like 8 hours. Sleep is very important for a medical student, because after when you take a proper sleep, you understand, you really memorize the things very fastly. So make yourself relax when you study. USMLE questions. When you do USMLE questions, read out statement and understand it. Focus on age of the patient. This is really important. Age of the patient and labs. Focus on the clues in the questions. Clues in the questions, like if you have any disease, they will of course tell you the clues inside the question. So make a diagnosis and then look at the options. Don't look options first. First make a diagnosis and then look at the options. Do not in hurry, like don't look options first. First of all, you have to make a diagnosis in your mind. Stay with your answer. Do not overthink. So during exam, do not panic. During exam, relax yourself that it's not a battle, it's not a war. If you feel questions difficult, just mark it and do other questions, because you are provided only 1 minute for a single question. Take breaks. You will have 45 minutes. So try to take breaks after completion of every single block. It would lead you relaxation, believe me. Try to eat those food which makes your glucose level constant. Chocolates really lead to sudden hyperglycemia. So I'm not just saying you to not eat chocolates, but if you really have chocolate in the real exam, you can have it. Now, very important, residency. Apply for residency matchup when you are done with step 1 and step 2 scores. Go for on the ECFMG website and apply for your token for the matchup. If you are going to apply in 2015, you're gonna be matchup in 2016. So fill out your gap. Fill out your gap means you have to do observership, clerkship in United States, because program director really focus on these things. If a student who is just preparing for USMLE and he's not going for observership or clerkship, and he's just sitting in a room studying for like 1 year, and who is not attached with the hospitals, so it will be like will make your you can make your score high, but if you are attached with the hospital, it is well and good that it makes your resume, your CV very high to get high chances in the residency. Make lot of Lord's letter of recommendations. High score is like pays the bill. High score, first of all, just think about high score. Then you have to think about letter of recommendations and observership and clerkship. High scores really pays the bill. Apply for USMLE exam. Go to ecfmg.org and get the information from IWA for online application. Fees are like 1060 for step 1, and for single steps it may be changed. I'm not sure, but I'm just letting you guys know that it is about $1100. So best of luck for the exam. I hope you will get something from this video. Thank you for watching. Please be free to subscribe and give us your comments. Sincerely, Humanity First channel. Thank you so much.